Hey, Dr. Stanley here to talk to you about the brain. So have you ever wondered why things like trauma, like flashbacks, like stress, those reactions feel so out of your control at times, or it feels like things are happening like right here in the here and now, even if they're in the past? Today we're going to take a quick look at a few parts of our brain that impact that process, and most importantly, what we can do about it. Okay, so the first thing I want to talk about is our amygdala. So our amygdala is the smoke detector in our brain. It basically is what sends our body into fight or flight when we are sensing some sort of danger, right? So everybody has that amygdala. Everyone's will kind of go off when there's perceived danger. The problem is trauma actually rewires that amygdala. So it makes it malfunction to where we feel like that smoke detector is going off all of the time, or at a lot of times when maybe it doesn't need to, that there's no real danger, right? So things like maybe a loud noise that might startle somebody who hasn't been through trauma, well, that might absolutely send somebody into a panic if they have been through that trauma and their amygdala is kind of rewired. So it really stays hyperactive after trauma, right? There's another part of our brain called the hippocampus, and that is our memory center. It is responsible for the progression of memories. It helps us kind of determine what's in the past versus what's in the present, so that timeline. What happens when we're under chronic stress, though, is that our body releases the stress hormone called cortisol. And what that does to our hippocampus in the brain is it actually floods the hippocampus and it makes it start to malfunction. It doesn't work as well as it normally does. And because of that, sometimes it's really hard for that hippocampus to differentiate between the here and now and the past when maybe there was danger or that trauma that happened. And so things start to get a little cloudy, and people who have endured trauma, they start to feel like it is happening again, right? Like it is this danger here and now. And that's because of those mechanisms in your brain that are basically, again, rewired after that trauma. So then what do we do about it, right? Because having an understanding of it is one thing, but then what do we do about it? Well, there are lots of strategies that we can implement, different relaxation strategies, different grounding techniques, some deep breathing, to help kind of take the edge off in those situations so they start to function a little bit better, right? And then we're also going to recommend, if you've been through some significant trauma, some therapy, right? Some therapy targeting that trauma in the longer run is going to help rewire that amygdala to where it's functioning a bit better, help have that hippocampus have a little more clarity, a little more of a rational kind of reaction when things are going on in front of you. That way you're not thinking that you're in danger from that past trauma, right? And so with time and effort, our brain can heal, right? Our brain is very adaptable. Note though, I said with time and effort, because time doesn't heal by itself, right? But time gives us the opportunity to have some of that effort, to learn some of those skills, to work on these areas to lead to that brain change and helping to heal our brain.